Assalamu alaikum. We are starting this communication day. We have patient named Mr. Smith. He's 83 years, was admitted 10 days ago with pneumonia. He was okay and suppose he is for discharge when he had sudden cardiac arrest. And the wife was informed earlier that he was fine and suppose he will be for discharge. Your task is to sit with Mrs. Smith, the wife, and to speak about what happened and to address her concern. We will start now after sharing the timer. Ready, Dr. Roda?
Yes,
Dr.
ready.
Roda? Yeah, okay. Let's start.
Yes.
Hello there. I
Hello.
am Dr. Mukhtar, the doctor in the unit on call now. You must be Mrs. Smith.
Exactly. Yes, doctor.
Yeah, you are the wife of Mr. Smith,
Yes, correct, doctor.
and he is 83 years.
Yeah.
Yeah, how can I call you today?
You can call me Mrs. Smith.
Okay. You are the next of kin of for Mr. Smith.
Yep. Yeah.
Can I ask you what you know so far about Mr. Smith's condition?
Yeah, actually, my husband admitted to this hospital about 10 days back, and he has a chest infection. And actually, he was doing good. He's doing good. And I met the consultant earlier today, the consultant of his team, and he told me he's ready for discharge tomorrow. But I don't know, doctor. Just before like 1 hour, I saw a lot of people coming to my husband's room. They just coming very fast, and they told me just to stay outside. Um, is there anything happening, doctor? Tell me. Can I see my husband?
Yeah, I appreciate your knowledge and your care for your husband, and I will address all your concern. Anytime you can stop me and you ask
Mhm.
me whatever you want, okay?
Sure, sure.
Before going further, can I ask you, you have any idea about what's going on?
Really, no idea, doctor. Maybe I have no idea.
Okay, I appreciate your concern, Mrs. Smith. Let me explain to you what happened with Mr. Smith today.
Mhm.
Actually, as you told me, early morning he was seen by our consultant, and he has been decided to allow him to go home.
Mhm.
Unfortunately, a while
Mhm.
ago they called me, and I have some bad news. I'm afraid to say this bad news to you. Are
Well,
you
okay.
okay for?
Yeah, yeah. Please proceed, doctor.
Yeah. Okay, Mrs. Smith. Actually, Mr. Smith heart stopped a while ago from beating, and
Mhm.
yeah, we did some heart massage for him.
Uh-huh. Huh? And then,
Yeah, unfortunately, his heart not responded to this massage.
what do you mean, doctor? Is he passed?
Yes,
Is he passed, doctor? That is the thing that you want to tell me?
yeah, I'm
Passed away.
afraid to say, yeah, he didn't respond to our massage and our attempt to resume his heart beating. I'm sorry to say that, Mrs. Smith. Uh, yes, Mr. Smith is dead now.
My God, doctor, this is really unexpected. I. I don't know what to say.
Yes,
I was with him earlier in the morning and they told me that he is ready for discharge and I have just come now from my home to visit him. I don't know. I
yes,
think there is something wrong. Are you sure that, are you talking about my husband?
yes, Mrs. Smith. We are not deliver such kind of information unless we are double check the information for the patient. I'm sorry to say that. Are you okay? I can provide you some tissue or water glass.
I'm all right, doctor. I'm all right. So, what could be the cause of his death?
Um, I appreciate your concern and I can see how much you are frustrated. Actually, his heart stopped suddenly without any clear cause. For such
Mhm.
reason, we have to do our workup, which is called post-mortem study. Did you hear about that before?
No, no, just proceed.
Yeah. This study will be carried out by a professional team, experienced one. We will try to reach and to figure out what exactly happened to Mr. Smith at the last moments.
What do you mean, doctor? You mean like they are doing like exam for him,
Yeah, I
for
appreciate
his
your
dead body?
concern. Yes, actually, this study will be done by cutting small cuts in his body in
Mhm.
hidden areas,
Mhm.
and they might reach to some organs inside his body and to find out what was the exact cause for his death. Are you okay with that?
And I don't know, doctor. I don't know. You are the doctor. I am me also. I want to know what the cause of death, doctor. But doctor,
Yeah,
in your like experience, what could be the reason? What could be like? Just give
actually,
me like yeah.
yeah, I appreciate your concern, Mrs. Smith. Actually, in such kind of sudden heart stop, we can give a reason for what's called heart attack, or might
Mhm.
be blood clot inside in the blood channel of the lungs.
Mhm. Mhm.
These are the possible causes, along with his underlying disease, which is pneumonia, chest
Mhm.
lung infection.
Mhm.
It might be also related to the bug, maybe the bug recur back to his lung, but actually it will not be like a sudden, all of a sudden. So the reason
Mhm.
I explained earlier might be the reason for his death.
But doctor, what about like does this postmortem exam? Doctor, I don't want this postmortem exam.
I appreciate your concern, Mrs. Smith. Actually, this exam is optional. If you don't want, we can cancel it. But for the sake
Mhm.
of the patient to know what happened to him at the last moments
Mhm.
and to have a reason can explain what happened to Mr. Smith. We are doing this exam. If you are okay, you can sign the consent. You can read this paper carefully
Mhm.
and read it. You can
Mhm.
call your son. You can
Tonight.
consult some of your friends,
Good, Alhamdulillah.
or you can consult your friend or any family member.
Mhm.
And uh, at the end of the paper, you can sign this consent. But be
Sure.
sure that anytime you can withdraw and you can cancel this procedure. Is that okay?
So, doctor, if I agree, does this will delay the funeral process? We are Jewish, doctor, and the funeral process should be done in our religion within 24 hours. So, is this gonna delay the funeral process, doctor?
I appreciate your concern, Mrs. Smith. Be sure that this study will be done as soon as possible. We will not
Mhm.
delay your funeral process, and we will try to do this procedure as soon as possible, and we will hand you the death certificate whenever the test or the exam will be done.
So,
Are you
doctor, can
okay?
I see him? Yeah. Can I see him, please?
Yes, I appreciate that. You can see Mr. Smith before
Mhm,
doing this exam.
mhm,
And again, I can assure you that we are here around
mhm,
you, all of us, to support you. If you need any
mhm.
help, you can call us. Are you okay with
Okay,
that?
doctor. Yeah, yeah. Doctor, I want to speak with the consultant of the team. But I'm not seeing them. I know this is now 3 a.m., but can I speak with them earlier in the morning?
Yes, I appreciate that. You can meet our consultant at early morning.
Mhm.
And if you need any help, let us know.
Okay, okay. Okay, sure.
Any other concern?
No, not really.
Okay, I will hand you some leaflet brochure about the postmortem exam. You can read
Mhm.
it carefully, and you can contact us if you need any help.
All right, all right. Thank you, doctor.
Okay, we can provide you with our debriefing team to sit with you and to support you as well.
Great. Thank you, doctor.
Okay, time is up.
Yes.
You can comment now.
All right. Yeah, you did great in the introduction. Um, the introduction is good. You can add like if she want to invite anyone, because this is a
Yes,
very bad news. Also, like you took time in giving her this bad news. You took time when you want to tell her that your husband
to
died.
prepare. Yes,
Yes, you
I'm
took a
preparing
lot.
here. Yeah,
Mm.
yes,
And yes, and then your husband passed. Yeah, yeah. Like if she told you any possibilities, tell me anything, any possible causes. You forgot to tell her that your husband had a mild chest pain, and then before this is fact written in the scenario that the husband had a mild chest pain, then he lost consciousness. Then proceed with what you told her. It could be a BE, it could be a myocardial infarction, could be dissecting aortic aneurysm, whatever. We will investigate and see. This case is a coroner, not hospital postmortem, because the patient was recovering well and had an unexpected death inside the hospital. So it is a coroner postmortem. So you will refer the patient to the coroner, and
نعم.
he is the one who will
هاي
decide if the patient need a postmortem exam or not. So the death certificate will be written by him.
هذا صوت
Second, there is no need for the consultant for consent from the relative. And I think when she asked you about the funeral process, we are Jewish and something, really, I don't know the answer, but if I were you, I could tell her I appreciate your concern. Actually, this kind of exam done within 2 to 3 days, and I will deliver your concern to the consultant of the team that's covering your patient and to the coroner himself, but I'm not guarantee that it will be done within 24 hours. But I will deliver your concern, and hopefully there will not be like any kind of delay in the funeral process. I will not give her any promises. And good, you told her about the bereavement team. Uh, what else? You can ask her about anyone dependent on him. Then, yes, you told her our consultant, you are the on-call. You are not part of the team, of the geriatric team. You are just on call. You know about the case, yes, but he's not your consultant. So just you can give her a hint that you are the on-call. You are not part of the team that treating her husband, but you have a good idea about the case. You went through the case, they went through the document. You are the on-call, of course, you will know about him, but you are not part of his team. So he's not your consultant. So when she told you, yes, I want to speak with a consultant. Yes, that is why I want to make like a hint for you. Yes, she can speak with a consultant of the team covering her husband earlier in the morning. This is her right. And also, as you said, this is her right to see her husband before and after doing the exam. Yes, this is my comment. Okay, thank you. But you did great.
Yeah, thank you, Fadila.
Welcome.
السلام عليكم
عليكم السلام ورحمة الله وبركاته.
دكتور باسم كيف حالك؟
وأهلين.
Actually, I have one question and a few comments. My question is, the general rule in station 4 of communication station is no treatment and no diagnosis, right? So when the surrogate asks about what is the, based on your experience, what could be behind the cause of it? I don't know, I should mention some differential diagnosis or should give general answer that is why we need to do postmortem examination. This is my question.
Yeah, since it was written here that the patient had chest pain earlier before the event and he lost the consciousness,
Yeah.
you can give some differential. So the chest pain before arrest might be either cardiac arrest, MI, or cardiac arrest due to respiratory arrest, which could be also related to PE. This is what we are experiencing in the real life. If
Yes, but
patient,
this is a
yeah,
communication station. The general rule that no
yeah,
treatment
you
and no
didn't give,
diagnosis.
yeah, no, no, she asked you. You will not be volunteer to say, but if she asked you, you can tell her.
Okay.
This is yeah. If she asked you, I didn't tell her until she asked me. But if she didn't ask, I will not say because I don't know. I'm not 100% sure what happened with him.
Yeah.
Yeah,
Okay.
this is. But I have question for Dr. Rhoda and all of you.
Yes.
If the patient, yeah, what I remember, the coroner indication,
Hmm.
unexpected death after admission within 24 hours, or death on table. But this
Yeah, yeah, yeah.
scenario,
Yes.
yeah, in this scenario, he was
Can I come
admitted
in
10 days.
once, Dr.
Yeah.
Basin, Dr. Ruda? You did a great job of picking up this. So I tell you, I've done this scenario with two people who are directly associated with PACES. One is a PACES examiner, and one was a surrogate in PACES, and she's in the UK.
Uh-huh.
When you are explaining number one, as Dr. Ruda did, just explain her fast enough and complete that sentence that I'm sorry he's dead. Be very fast. It has to be within 2 or 3 minutes. If you delay that, the other half of the things will be like it will be left because
Yeah,
this patient will be sobbing, crying, be angry.
yeah,
If you go through the scenario, this patient was supposed to be discharged. Okay, if you
yes,
read it
yeah,
again, and now he's suddenly dead. That is a clinical indication that there might have been something more than what has happened, exactly why he needs to be seen. What number one we will do, we refer usually to a medical examiner, and there after a coroner is there. Okay, and these are the people who would see whether this case needs post-mortem. You are not going to say he needs a post-mortem. You are not the person to say he needs a post-mortem. You'd say there's a team. If you don't want to say medical examiner, fine. You can say like as it goes, we would like a team to see him, which would include a coroner, and he might. I'm sorry, your husband might undergo a post-mortem, or his mortal remains might undergo a postmortem. However you feel, whatever language you want, but be very simple. But because this will be referred, this is not always that they are going to do it. in 90%, yes, don't forget, don't need to remember any other postmortem. So in 90% of the cases, as of the patient's examiner, Dr. Punekar says, they do not go for a postmortem because they just ask the consultant, the whole team, they will ask the consultant, like, does this patient need to undergo a postmortem? They say no. Forget about that. You're not going to say that in exam because as you mentioned the postmortem, the next questions will come into place. Like, why my husband? What happened? As she asked, you have to answer like as it is written in the scenario. You have to say like, I'm quite unsure. However, he did have have these symptoms as she said, and you have to say like, it might be this, it might be that. But I guess we'll be in a better position once the team goes into search, and maybe he might require a postmortem. Then the other things will come. But don't say he will undergo postmortem. In Except when you read the scenario and except when the scenario is being played out, except the words that is written in the scenario, don't say he will, I will, because it is very difficult. Of course, there's a different issue when, like, I will talk with the consultant. That's okay. Like there was a word when you said, if I can remember, I cannot remember. Like, don't promise that much. Are you getting me? So the first thing is break out the death at
Yes.
first, number one, as early as possible. Allow the person to be angry, be crying, because that will take another like 30-40 seconds of your time to bring her back to the scenario. And then you will say that we will have a discussion with the team. There'll be a medical examiner and there'll be a coroner also there. And it might be the scenario where basically he might undergo. That is the thing. That is there and there. And rest of it, you can play it all properly. Don't say he will undergo. Okay? That
Yeah,
is just, yeah, that is just exactly how the PACES examiners have said. That's why I'm saying you.
yeah, I agree with you. Yes. So
Okay,
unless it
Dr.
was,
Basim.
yes,
Pardon?
تفضل.
Yes. So after you break the bad news that he's passed away or he's dead, show
No,
some
don't say
empathy.
passed away. Don't say passed away.
He's dead. He's dead.
Don't
Yes.
say he's arrested. Absolutely no. Be very clear cut. His
Mm,
heart had stopped. We tried to revive him. I'm sorry, he's dead. Has to be the word dead.
yes. After that,
Absolutely blunt. Look at it, the patient's or the surrogate's eyes. I mean, say the surrogate's eyes. Absolutely spot on. Don't utter anything else except he's dead. You are going to confuse the whole scenario otherwise. If you're uttering anything except that, like he was trying to prepare. I know in real life scenarios we try to prepare and prepare, and then we bring out this is in real life, but this is Space's world. You're not going to get a time. Be very blunt, but very soft. But you have to say, "I'm sorry, he's dead."
okay.
Are you getting me?
Uh, yeah. So the other thing, Dr. Basim, when the surrogate asked you about, he told she didn't want to do postmortem. Here, I think the answer would be, I'm sorry to tell you that, but it is important by law because the only one who is responsible to issue the death certificate is the coroner, right? So this not
It's
option.
that's why your wordings are important. He may undergo a postmortem. We are not
Yes,
sure now. Understand?
but
Once
refer
you say
to
he
the
may,
coroner.
the patient, the wife will ask, "What do you say? Think he may?" So you say, "I'm not sure. I'm not the person to make the decision." Okay, and I'm very sorry that I am actually delaying the whole thing right now. If you are saying he will undergo postmortem, you are taking the decision. You are no one here. You are just somebody on call and SHO on call. You're not going to make the decision. You might be at best a registrar on call. You're not still not making the decision. This is a decision which is taken by a very separate team, the consultant, and there is a medical examiner and there is a coroner. We've absolutely clear cut. No one else is taking that decision. Okay.
Yeah, let me answer also him in
Uh,
another way.
a-
Yeah, thank you, Dr.
don't
Bora.
say one more thing, and don't say, I'd like to add one more. Sorry, I'm just
No, it's okay. It's
reflecting now.
open.
And
It's open for you.
just
Yes.
don't say, yeah, and don't say one more thing like we are going to learn many more things, like how he is dead. That is a medical postmortem, which is actually not done nowadays in the UK.
No, I
Okay.
didn't mention that. Yes, it's not the time to mention that.
Ah,
You can say only we are searching for the reason or for the cause of his death, but don't say we are learning from these steps
don't say. Yes,
because
absolutely.
yeah,
Don't say.
yeah, you're right. Yes. Let me answer. Thank you, Dr. Bora, for your comment.
Yeah,
And be
thank you.
sure
That's a
that
very good
yeah,
decision. That's a very good actually session. Nice.
yeah. Thank you, Dr. Bora. And be sure this meeting is open for all. Anytime you can share, and we are waiting for that. We are sharing our experience to have the benefit and to learn from each other. So anyone can ask and share, can comment. Thank you, Dr. Bora, again. Let me answer Dr. I don't know his name, but I drive the scenario as postpartum. That's why I said to her, it's your option or it's optional because the postmortem study is optional one. In contrast to the coroner will be like uh, not optional one. It will be by law, as you said. So if you decided that it will be for postmortem study, you can give her the option and she can sign the consent. For the coroner, no consent. This is the difference between both. Someone asked this question earlier. So these are the differences between coroner and postmortem. What I know in PACES, two indication for coroner, death on table, any surgery, any cath lab, and the other indication is death within 24 hours of admission. That's why I drive the scenario like postmortem. These are the indication for coroner in PACES, death on table or 24 within 24 hours of admission to the hospital, which in this scenario were not from this indication. That's why I drive by the other way, which is postmortem. Postmortem, you can do it for any patient dead in the hospital, of course, after 24 hours, even patient unexpected. This is my opinion. Sometimes they are saying for learning purpose. We are doing some researches and so on. So apart from the two indication, you can drive the scenario as postmortem. Postmortem. That's why I did this scenario as postmortem. I don't know if Dr. Roda agree for that. Dr. Bora also said be diplomatic. I mean, you can tell to the surrogate or to the relative or to the wife, we didn't decide it. It will be referred to authority, and this authority will decide either to be coroner or it will be like postmortem. It's like diplomatic answer. You will not be giving a clear cut. It will be postmortem because still you are on duty and you are not consultant and you are not the treating team. So I agree with this opinion. You can just tell her we can wait till some authority or some expert team to see your husband, and they will decide if they can do this or that. I think this is best way to answer this. Yes. Hello. Yes. Sorry, maybe my mistake. Okay. There is some comment. Let me read. Here, patient improving, death unexpected. Yes, Dr. Rod, I agree, but still he had pneumonia, he had hypertension, he was admitted. So even he's unexpected to have a death or cardiac arrest. He's elderly, frail patient. So better to refer to coroner to decide if postmortem needed or not. Okay. if I face this scenario again, I will do like Dr. Bora did, or as Dr. Bora said, just refer to the team and the team will decide. Because I am not sure is it coroner or post-mortem. This is a general law and you can do it in a diplomatic way. It's not clear from this way and not clear from the other way. Okay?
Yes,
I
and
hope
if
it's clear.
suppose, yeah, absolutely. And if the scenario demanded, like if the scenario said that you have to discuss about his death and then the post-mortem, that is different thing altogether. Then definitely you have to discuss clearly. Okay, the team has decided
Yeah,
that this patient is to undergo post-mortem. Okay, already has been decided. That is different.
yes,
Then the task
yeah,
is different. If it is not mentioned, don't say he will undergo. That is the point that was actually reflected by Dr. Punekar. Don't say, because you
yeah,
don't know. You are just a part of a team who is at the,
yes.
you are the lower rank. You're not making the decision. Absolutely clear.
Yeah, yeah, I agree. Yes.
Mm-hmm.
Actually, in the exam, the card will show you what's your task. Breaking
Mm.
bad news, or counseling about disease, counseling about medication, medical error, or such scenario. They will mention to you corona or postmortem. They are not hiding the task as before. They are giving to you clear task. Talk about, for example, corona. I think so. Medical error, they will specify to you what the scenario category, medical error. So you have to do the steps of medical error. As well as in this scenario, they will mention to you either postmortem or corona, just to be sure that no debate will be in the exam and no hidden agenda as they are doing or as they were doing before. Okay? Any other question, any comment from others? Okay, you can read your scenario, Dr. Roda. You read it?
All right.
You can read it loudly before starting.
I cannot see the scenario
On the screen now.
on the screen. Hold on. Okay. He had been admitted 6 weeks ago with uncomplicated MI. He had coronary angio, which despite his 10 years history of DM, showed single vessel
दिन
disease.
रात ये बहस ही कुछ करते रहा
Yeah,
क्लास हो रही
showed a single vessel disease not requiring angioplasty or stent. His echo was normal. He is taking aspirin, clopidogrel, bisoprolol, ramipril, and atorva. Because of SOB, his GB ran a blood test that showed hemoglobin of 77 gram per liter with a low MCV and low serum ferritin. Renal and liver function were normal. No any GIT symptoms and no chest pain after discharge. 6 weeks ago, during his admission, his hemoglobin was 115. 2 years ago was 140. Your tax explained that likely to have anemia. His medication for his coronaries may have exacerbated. I cannot see. The anemia,
Okay.
you outline the
It's the
further
anemia. You
investigation.
outline the further investigation that are needed. Okay, Mr. Adam Smith, 48 years. Okay.
Mm. Mhm.
Take 2 minutes, then we'll start.
All right.
Are you ready?
Yes, doctor, ready. But doctor, in this scenario, like me, the one who are going to outline the investigation, like anything written, or you will
Yes, you
discuss it
will do.
after the.
There is hidden procedure. You can explore it.
All right, all right. Thank you.
Okay. Yeah. Okay. Let's start.
Yes. Hello there. I'm
Yes,
Dr. Zain. Yes. One of the doctor covering the service today. Am I talking to Mr. Adam Smith, 48-year-old?
Yes. Yes, I am.
It's nice to meet you.
Thank you.
Yes, we are here to discuss issues related to your health. Is that all right?
Sure, doctor.
Do you want anyone to attend the meeting with us?
I'm fine, doctor.
Yeah. And to be on the same page, tell me how far do you know about your health condition?
Actually, doctor, I don't know what's happening with me. I had a
Mm-hmm.
heart attack 6 weeks ago, and I did a scan to my
Mm-hmm.
blood channel of the heart, and it revealed
Yes.
nothing. Uh,
Yeah.
they prescribed for me some medicine, and I read about
Mm.
this medicine, and I
Mm.
read it can cause some
Mm.
reduce of blood count, and I'm worried about that.
Mm-hmm.
Yes, doctor.
Mm-hmm. Mm-hmm. So, and how are you doing so far after this heart attack?
I'm okay, doctor. I'm taking all this medicine, and I'm compliant to my plan, exercise, everything.
Mm.
But I'm worried about my low blood count.
Yeah, yeah, I can see. And yeah, and exactly what the medication that you are have worries about it.
Yeah, what's called blood thinner, aspirin and Plavix. Since I have low blood count,
Mm.
why they are giving me this medicine?
Mm-hmm, mm-hmm. And that's exactly what is running in your mind, that you expect that these medication are the reason that causing you a blood
Yes.
count.
Yeah.
Yeah. So thank you for sharing this information with me. And I imagine that what you have been passing through, that you have a heart attack 6 weeks ago, and yeah, they did for you a scan, and they started you on a medication, including those blood thinning medication that's called aspirin and Plavix, as you say. And recently, as written in your note, that you had like a kind of a shortness of breath, and you visited your GP, and he did investigation and showed your blood count is a 77, which is below the normal. Are you with me?
Yeah, doctor. Yes.
Yeah, yeah, and 6 weeks back it was normal, and yeah, and actually this is what we call it, anemia. Are you familiar with this term?
Yes, doctor. I know about anemia, and I know that there is some types of anemia, but I don't know
Yes, yes,
what type of anemia I have.
yeah. Do you want me to explain it? Yeah,
Yeah, doctor, can you tell me what type of anemia I have
yeah.
and why I have this anemia?
Yeah, yeah. As you said, yes, I appreciate your knowledge that there is many types of it. One of the type, actually, let me draw for you. If this is the blood, we need to our body to produce the blood need what is called the ferrous, the ion, we call it. It is one of the mineral needed to produce the blood. And actually, we tested this in your body. We call it the ferritin level, which is give us a picture about the store of the iron in our body, and it was low. And hence, your anemia could be related to this low level of the iron. Are you with me?
Yes, doctor.
And this usually could be related to a blood loss. And actually, when I revise your note that you have no any kind of symptoms like a tummy pain or like a throwing up, but actually this happened to people without symptoms. They may lose blood in their stool without having any symptoms, and even the stool color will be normal. And are you with me?
Yes, doctor. Yes, I can understand.
Yeah, and it could be related to the medication that you had been prescribed for your best interest, which were the aspirin. And yeah, and and this will bring me to further investigation that we need to confirm this. Are you with me?
Yeah, doctor. What you want to say, doctor? You want to do some test again?
Yeah. Yeah, exactly. We need to do a camera test through your lower back passage to know exactly what could be the reason for you to lose this blood.
Oh my God, doctor.
Uh, mm, yeah.
It's
Yes.
so difficult, doctor, to do this test for me.
May I know why?
Yeah, I read about it before, but it's so hard to
Mhm,
pass a camera through my back passage. It goes through my
mhm,
gut.
mm, mm. Uh-huh. Like, do you want me like to explain it further? May I make fill a gap
Yes,
for you?
please, doctor.
Yeah. Actually, we are gonna do this camera test to see if it's very important in your condition to see if you have losing blood from your back passage. And this is for your best interest. And beside, we may also examine your stool to see if there is a blood from the start. For the camera test is a kind of an easy test done by experts many times. You will be given a leaflet about the restriction that needed to be done before and after. During this procedure, you will be in a special position. You will be like awake. But in case that you have any kind of stress or being anxious, we may be like semi-awake, like give you something to be like partially sleep. Are you with me?
Yes, doctor, I
And
can.
yeah, and you will be like a fully monitored for that. And actually, we may do this camera test from the upper um, passages, I mean through your food pipe and from your lower passages. We may do those two camera tests. Are you with me?
Yes, doctor, I'm following you.
Yeah, just to see all the just to see all your guts. And then through the camera, we will see exactly what is happening inside. If we see like any kind of bleeding, we may treat it and we may take a snip and send it to the lab to investigate it. After that, you
Okay.
will stay in the hospital for like a few hours just to be like monitored. After that, we may ask someone with you to drive you home. Is that all right?
Yes, doctor. Okay.
Yeah. And we are gonna, before this procedure, we're gonna like review your medication. All right. And if you agree, you are gonna sign a consent.
Okay, doctor.
All right. So are you with us with the procedure?
Actually, doctor, I have no choice, doctor.
All right. All right. So we will give you like a consent. You will read it carefully, in which all the procedure prescribed, and read it carefully, and you can withdraw it at any time. It's your right. All right.
Okay, doctor. I have concern, doctor.
Yes,
I
tell
have a
me.
question.
Yes.
Does the medication I take maybe
Mhm.
the reason of this bleeding?
Actually, I do really appreciate your concern. It could be related to your bleeding, but usually it could be or it could not. Usually, this kind of medication may lead like a soreness in the tummy, and some people may have symptoms and some may not. So it's a earlier to answer this question right now, doing our further investigation. Does that answer your concern?
Yes, doctor. I also believe that because my blood count before I start this medicine was still losing and declining. So I think also not related to this medicine.
Yeah,
Is it?
yeah, we are gonna like see it. We will gonna also consult the heart doctor for both the Plavix and the aspirin, because the aspirin may lead to soreness and the Plavix actually may lead to decrease in the blood count. Does that answer your concern?
Yeah, doctor. Thank you. Time is up.
Okay, thank you. Thank you.
Okay, well done, Dr. Huda. You explore what's hidden in this scenario, which is upper and lower endoscopy, to rule out any cause or any underlying pathology for the bleeding. Uh, although no signs of abdominal or GI symptoms, but still it might be like hidden bleeding, and you might do some test as it said, which is occult blood in the stool. Although it's not obvious one, it might be hidden. So it might be it's explored either by this test or by camera scan. Actually, before starting aspirin and Plavix, if you read the scenario, hemoglobin count was decreasing before starting aspirin and Plavix. If you read the last paragraph, you will find that the patient had declining hemoglobin from 14 to 11 2 years back, and he started aspirin and Plavix 6 weeks, isn't? So there is some pathology which can be hidden in this patient, which is iron deficiency anemia, and you should do the test to confirm, which is endoscopy upper and lower. Apart from this, as the scenario from the start, you did it well. You confirmed the patient's data, the invitation, the idea about the disease, opinion or the expectation about what's ongoing, and explanation of the anemia, how is it, and what the cause of this. And then you go through the test, which is camera scan, the preparation before and during and after. You did it in brief. You told me in brief way. We should review your medication and about the awakeness during the procedure. You will be either awake or semi-awake according to your pain threshold or pain tolerance. Then it will be like 1 day or daycare procedure. It will be for 1 day after monitoring you and confirming that everything will be fine. Someone can drive you home. So I think from my point of view, you did this scenario perfect. I think you cover all the point in this scenario. If anyone has comment for Dr. Roda or about this scenario, he can share with us.
So,
Yes,
Dr. Basim, the hidden agenda
yes,
here,
yes,
the upper and
yes,
lower
endoscopy.
endoscopy.
Yes, exactly.
And can we just say about the stool investigation also?
Yes, we are doing this test because it might be hidden with some of the patients. They will not have clear blood or clear melena, especially if they have a mild bleeding. Again, read I share the scenario. During the admission, his hemoglobin was 11, and his hemoglobin 2 years back was 14. So it was before starting the aspirin and Plavix. Although the aspirin can worse the condition, but you should screen him. He might have some hidden pathology, and you should do this procedure. In the
So
procedure, yeah.
yeah,
Yes,
when
you
he
can
asked
ask.
about is the aspirin could be the reason, what should be like the ideal answer?
Yes, it can worse the condition, as you said. Although we can give you some medicine to protect your stomach from soreness, but still we have to rule out any other possible pathology or any other possible condition or any other possible disease in your gut. So what you did is perfect, Dr. Roda.
No,
Okay.
no,
You have any other concern or question?
no, thank
Yeah, Dr. Hadil asked, this is explanation of iron deficiency. Yes, it's because they mentioned that ferritin is low. As Dr. Roda said, she explained iron deficiency anemia, that the iron, which is some supplement or some mineral or some salt inside our body, you have it in a low level. So, due to this, we suspect you have some underlying cause, which can be iron deficiency anemia as a type of anemia. And for this reason, we have to do further investigation in the best of interest for your condition, which is endoscopy, upper and lower. Is procedure for iron deficiency anemia with unclear cause? Is procedure for iron? I didn't get this question. It's not, it's unclear. Yes, it's unclear because you don't have explanation, but it might be also some of the iron deficiency anemia causes, which are either a small ulcer or angioplasia in the in the gut, and even cancer colon. But I guess for the cancer colon, he will have other GI symptoms. So it might be either duodenal ulcer or angiodysplasia. Yeah. Okay. Thank you for thank you, Dr. Roda, for your scenario and your practice with me today.
Dr.
you.
Thank you for
Dr.
Basim,
yes,
Bass,
Dr.
yes,
Huda,
yes,
Huda,
yes.
sorry for coming again. Okay, you you played a very good session with two good, and by the way, I reconfirmed the whole scenario again, the prior one, the postmortem one, and I've shared it with your group. What Dr. Punekar replied just now, he was saying it's night 2:30. What are you doing? Okay. Anyways,
Yeah,
I'm in India. Okay, so it's like around 2:35 a.m. right now. Anyways, I'm just loving the scenario. So I'll tell
thank you.
you uh, one important point which is there in this scenario. So, with any iron deficiency anemia, forget about the scenario at first. With any iron deficiency anemia, they love to rule out celiac first, and then they will do a urine dipstick. Okay, that is the
Yeah,
second
you mean yeah, you
urine.
mean loss of
They will
yeah,
take urine
hematuria.
for
Yeah,
hematuria.
microscopic hematuria. Yes, yeah.
Yes, and you have cleverly put the renal tests were normal. Okay. But if it is not written, like if the scenario says the creatinine is 1.2 or 1.1, they have not mentioned the urine examination in this scenario. Suppose the same scenario you have given, the liver test was normal, so ferritin is low, and you have said the creatinine is 1.1. You have to utter the word, will check your water works, your bowel works, and then possibly we'll do a camera test up and down, however it goes on. All right?
Yeah, I agree.
Are you
I
getting
agree
me?
with you. Yeah, yeah, yeah,
That is,
sure, sure. Yes,
yeah. With the same
microscopic
scenario, suppose
hematuria.
there is
Yes,
antiplatelet,
yes.
there is antiplatelet. You don't know. There are lots of things. So you have to also utter the word celiac disease also here. Okay. Suppose
Okay.
there is no mention of like nothing is mentioned about his bowels. So iron
No,
deficiency anemia per se, according to British, is basically you have to rule out celiac, you have to rule out urothelial malignancies, you have to rule out the GI malignancies. These are the three that they go into. So you have to take it part by part uh, as per given in the scenario. I think so. I'm making it a bit jumbled, but I
no,
guess
no,
you got.
it's okay. No, no, thank you, Dr. Bora. But let me explain to you that here in the scenario written no any GI symptom.
No, I
So I think,
understand. I understand.
yeah,
I understand. That's why celiac disease is not needed. Screening is not needed. That part is gone. Since you have written the renal tests are normal, so you're not going to do another, you're not going for another urine test. Okay. But you're just now going into the stool test and the upper and lower GI. Suppose these things were not mentioned. Suppose the patient is having uh, anemia. Okay. Only anemia. Nothing is mentioned except the tests. not mention about his like stool is normal. Then the first point will be his celiac disease. Next point will be his urine test. Third point will be his bowel evaluation. Are you getting me?
Yes, Dr. Boy, yes, I got it. Thank
Ah,
you.
because you have written no GI symptoms, you're not going for any celiac screen. But they still love the celiac screen somehow. Anyways, they will do
Yeah,
it.
yeah,
I
yeah.
know. Ah,
I agree
then
with you.
you have written renal tests were normal, which means we would include the urine routine was normal. So you don't need to do the urine examination for hematuria. That's gone. That's second. Now the rest remaining is upper and lower GI bleed plus the stool examination for occult blood or FIT, however it goes on. Are you getting me?
Yeah, yeah,
It will
okay,
play
okay.
by the
Thank you.
scenario. Just be careful because you played out the scenario like this. The scenario might be in the other way around where they might not mention anything about the GI symptoms. They might not mention about the urine test. Then you have to say that we're going for celiac. We'll be testing for this. We're testing for this. This is
Yes,
basically a test of your clinical judgment only.
yes,
Okay.
yes, yes.
Ah.
Yeah. Okay, thank you, Dr. Bora, again.
Uh-huh. So
Okay.
you may or you may not need the this one because if celiac is positive, they'll treat for celiac as first. That is how they goes in the this one
Yeah, of course,
gastroenterologist.
of course.
Ah,
Yes.
thank you. By the way, I've reconfirmed the whole scenario of the postmortem and he just posted it back and I'm posted back in their group. Okay, thank you so much for a lovely discussion.
Okay, thank you. Thank you so much, Dr. Bora. Yeah, so you will share the feedback in the group, the WhatsApp group. Yeah, you send it. Okay.
I
So
already
let's
did that.
yeah, yeah, okay, let's read it. Yeah, you bother the consultant. He was sleepy. It's 2:30. Yes, okay. Let's read what he wrote. We will look into this matter and our medical examiner will assess the case in detail and consider a referral to coroner. If the coroner gets involved, it is possible they might ask for postmortem. Yes, okay. So it's like again, yes, diplomatic answer, not
These
100%
these
true.
are the words that he
Yeah.
says. Yes, yes.
Yeah, I can read. Yeah. So you can, yeah, refer to the assigned team, and the assigned team will decide, not you, not the consultant, or at least not you. It might be by the consultant in the morning. Okay, I think it's clear now for the primer, the first scenario and the second scenario. Also, Dr. Bora adds some comments about hematuria or microscopic hematuria. He should screen about added to the camera scan, or before doing camera scan, we should do screening for celiac as well as for hematuria or blood in the urine. Thank you, Dr. Bora, again. Thank you, Dr. Roda, for the practice. Thank you all for the comment, Dr. Hadil and others. If no question, no comment. Yeah, thank you, Dr. Roda. Okay, if no comment, we can end this session. Sorry for being late. Thank you, Dr. Bora. Okay, see you tomorrow with long clinical consultation day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.